Ketamine combined with other treatment makes alcoholics 2.5 times more likely to remain sober for 6 months. According to a study, giving alcoholics tiny dosages of ketamine could help them to stay sober. Experts from the University of Exeter examined the effects of the illegal party drug on 96 users, who consumed the equivalent of 50 pints of beer each week. They were divided into 4 groups to see how taking ketamine, in addition to regular talking therapy, affected them. When compared to addicts who received a placebo, those who were given ketamine were 2.5 times more likely to remain sober after 6 months. The medicine, which can be used as a horse tranquilizer, also indicated that individuals who took it were clean and sober for 162 out of 180 days, on average. Professor Celia Morgan and her team also reported that 6 months after receiving ketamine, patients had lower levels of depression and improved liver function. The results are looking promising. The graph depicts the average percentage of days that subjects in each of the 4 groups remained dry over the course of the 6-month study. According to statistics, 3/4 of alcoholics revert to excessive drinking habits within 6 months of stopping. In the late 2000s, it became popular as a party drug, with people using it before raves to get a more intense high. This occurs when people believe they have communicated with the Lord, or a higher force, which can lead to addiction as a result of their desire for that experience. Ketamine can also make people feel immobile, produce hallucinations, and trigger anxiety attacks, confusion, and loss of memory. Many people report that ketamine withdrawal is worse than any other drug, with some people contemplating suicide as a result. Possession of ketamine, which is classified as a Class B drug in the United Kingdom, can result in a sentence of up to 5 years in prison, while distributing it can result in a sentence of up to 14 years of imprisonment. One participant in the trial even described the combining of therapy and ketamine as a life-changing and mind-altering experience. The trial was truly revolutionary, to see if ketamine mixed with treatment could keep patients from resuming heavy drinking so rapidly after quitting. Half of the participants underwent psychiatric counseling, while the other half took alcohol education classes. Over the course of the 6-month study, those who were given ketamine plus treatment drank more than the advised amounts, but only for 5 days on average. After taking the medicine, no major side effects were noted. The researchers also stated that they are definitely not encouraging the use of ketamine outside of a therapeutic situation, since it carries clear hazards. Ketamine, which is classified as a Class B narcotic in the United Kingdom, is thought to function by producing a sense of being outside of your body, according to the researchers. The participants in the study normally drank an average of 125 units each week, which is 9 times the advised limit. Other studies have also shown that ketamine can be used to assist alcoholics stay sober, and that it can also be used to treat depression. Needless to say, the medical profession is very excited. If you have found this video interesting, please subscribe to help my channel.